1 minute.
The meeting of the Ramsey County Board of Commissioners is now called to order. Will the clerk please call the roll?
Fretham.
Here.
Matta-Castillo.
Here.
McDonough.
Here.
McGuire.
Here.
Ortega.
Aye.
Reinhardt.
Here.
Carter.
Here. Thank you very much. I'll call on Commissioner Fretham to say our Pledge of Allegiance while the others of us go on mute. Thank you, Commissioner Fretham.
Thank you. I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Fretham. Now that we've said our Pledge of Allegiance, I'd like to ask at the top of our meeting that we do our moment of mindful silence. And so I'll call on all board members for just that moment of mindfulness at this point. Thank you very much. While we have an agenda this morning that includes after our county board meeting, a Housing and Redevelopment Authority meeting, and also a closed board meeting to discuss a legal matter. It's important as we remember we are also recovering through pandemic, through the health, through the social, and through all of the unrest that we have seen in our environment. And we have centered ourselves at this point. We'll continue to center ourselves as we go through our day. Thank you very much. I will ask for a motion on the agenda for May 4th.
So moved, Madam Chair.
Second.
Thank you very much, Commissioner McGuire and Ortega for the motion and second. Is there any discussion on the agenda? Roll call, please.
Fretham.
Aye.
Matta-Castillo.
Aye.
McDonough.
Aye.
McGuire.
Aye.
Ortega.
Aye.
Reinhardt.
Aye.
Carter.
Aye. Thank you very much. The May 4th agenda is approved and the minutes of April 27th are before you. Is there a motion?
So
moved.
So moved.
Thank you, Commissioners Matta-Castillo and McDonough for the motion and second. Is there any discussion on the minutes? I'll ask the clerk to call the roll, please.
Fretham.
Aye.
Matta-Castillo.
Aye.
McDonough.
Aye.
McGuire.
Aye. Aye.
Ortega.
Aye.
Reinhardt.
Aye.
Carter.
Aye. And thank you so very much. The minutes are approved. We're moving into a proclamation in honor of Correctional Officers Week. I'll call on Commissioner Fretham for that proclamation.
Thank you, Chair Carter. Happy to read this proclamation today in honor of Correctional Officers Week. And my understanding is in the chambers we have Superintendent.
There is some noise in the chamber.
Madam Chair and Commissioner Fretham, we're just the men and women here to receive the proclamation. We're gathering as you were starting. Sorry about that.
Excellent. I'm so sorry. And so while we're asking them to gather at the front, it looks like they're there. and we can move forward with the proclamation. Commissioner Fretham, thank you.
Thank you. I'll read the proclamation. Whereas since 1984, the United States has recognized the first full week in May as National Correctional Officers and Employees Week. And whereas Ramsey County employs over 300 full-time and intermittent correctional officers, sergeants, lieutenants, captains, and support staff through both the Sheriff's Office and Community Corrections Department. And whereas Ramsey County correctional officers are skilled and professional men and women who serve 24 hours a day, 365 days a year to safely, securely, and humanely house inmates within the county, often in the face of violence and danger. And whereas last year, Ramsey County correctional officers safely and efficiently managed thousands of inmates at the Adult Detention Center and Correctional Facility. And whereas in 2020, many correctional officers lost their lives in the line of duty nationwide, including dozens who died from COVID-19 infections acquired while on duty. And whereas during this unprecedented time of worldwide pandemic, Ramsey County correctional officers remain committed to their duty to keep the inmates, staff, and community safe no matter the threat. Now, therefore, be it proclaimed that Ramsey County Board of Commissioners declares the week of May 2nd through 8th, 2021 as Correctional Officers Week in Ramsey County in honor of the dedicated professionals who safeguard the county's inmate populations. And be it further proclaimed that the Ramsey County Board of Commissioners encourages all residents in the community to pay tribute to the correctional officers in Ramsey County for the essential public service they provide. Thank you. My understanding is in the chambers, we have Superintendent Bill Finney, Assistant Superintendent Brad Lindbergh, and Assistant Superintendent Mike Johnson, along with others lieutenants present. And I will turn it over to all of you.
Madam President, members of the commission, Mr. Director, other staff, thank you. We appreciate the recognition of a job that we find challenging, a job that sometimes is very, very hard, but one that we love and we take seriously in providing that service for Ramsey County. So thank you for this recognition.
And Under Sheriff Finney, I was wondering if others would like to introduce themselves who are here with you today. We would love for them to take that moment and do so.
Hi, I'm Captain Michelle Landers from RCCF.
Nice to meet you.
Hi, Liz Reitz, Assistant Superintendent at the Ramsey County Correctional Facility.
Hello, my name is Captain Ole Pilabendate, RCCF.
Good morning, I'm Lieutenant Scalark, Ramsey County Sheriff Department.
I'm Lieutenant Mike Johnson, the Assistant Superintendent of the jail.
Good morning, Commissioners and Chair. I'm Brad Lindbergh, Assistant Superintendent of Administration, Sheriff's Office, Adult Detention Center.
Thank you.
Thank you very, very much, Commissioner Fretham, for the proclamation. Under Sheriff Finney and all who are gathered before us for the work that you do, for your commitment, for your skills and talents, for your compassion, as you help to ensure that inmates who spend time with us in our facilities are well cared for. You are the element of Ramsey County that helps us to ensure that compassionate care during times of difficulty when we are seeing people not necessarily at their best, at least not all the time. And we thank you for the work that you do on behalf of our entire community. We understand sometimes at risk to yourselves and to your families, and we appreciate that work so very, very much. We also know that you, as the front line in our facilities, are helping us to understand the work that we can do together in order to improve and enhance our ability to serve our community well. So we thank you so much for maintaining that care. We thank you so much for being that front line with us. We thank you so much for all of your attention and thoughts regarding the work that we are doing together. So very much appreciate your help. I see hands that are up in recognition of this day, and I will call on Commissioner Reinhardt and then Commissioner Matas-Castillo. Commissioner Reinhardt.
Thank you, Madam Chair, and thank you, Under Sheriff Finney. This is such an important proclamation. And I mean, the compassionate care and really working with people and trying to help them change the trajectory of their life in many cases is so incredibly important. And so the care is clearly recognized and appreciated, and the danger that is there at times is obviously also recognized. But I want to put a spotlight on the work that you do to really make changes in the people's lives that are there. This is an opportunity in some ways, not one that you would have chosen for someone to be there for this opportunity, but some of the programming that's being done is truly groundbreaking. Trying to prepare folks for skills going back into the community in different areas. I've been there for graduation ceremonies and have the one that I remember very, very well was for restaurant employees, hospitality industry. And the food was fantastic and the stories were amazing and really just heartwarming, because it not only had someone paying for what had happened or what they had done, but they were making a difference not only in their lives, but their families' lives and the community because of the skills and the support that they received, so that it's truly something that is life-changing for our entire community. So those opportunities that are given out of respect and care, I just wanted to recognize those and know how much appreciated they are. I want you to know how much they are appreciated in transforming systems, transforming lives. So thank you very, very much.
Thank you, Commissioner. Commissioner Matis Castillo.
Yes, thanks, Madam Chair. And I just want to echo our gratitude and words of acknowledgement. You know, we know that when you're intersecting with our community, it's often on their very worst days. And we hope that it doesn't become your worst day and when you do that interaction. And we just really appreciate, I know I personally appreciate the care, as Commissioner Reinhardt said, and the compassion when people are coming in at when they've really hit rock bottom, right? When they're coming into our facilities, things aren't going well for them. And to be able to recognize their humanity, even in that situation, your steadfast professionalism is really, really appreciated and recognized. And so I just wanted to say thank you all very, very much. And please pass that along to your colleagues who aren't here with you today, but that we truly recognize the work of the correctional officers and your professionalism, and that every day, even when it could be really bad, you put your uniform on and come back to work to serve our community. And it's truly appreciated. Thank you so much.
I just want to thank both commissioners for speaking on behalf of all of us. I think you would hear the same echoed were each one of the commissioners to share our thoughts. You should know also, of course, that we represent a community that is appreciative of the work that you do, again, with individuals who may be on their very worst day, as Commissioner Matis Castillo has said, and to ensure that we are providing opportunities for that better trajectory, as Commissioner Reinhardt has said. And so we know that there is much complexity to this work, and we are thankful for the opportunity to have you representing so many individuals who form teams ensuring that this work happens for our community, whether you're in the adult detention center or if you're in the Ramsey County Correctional Facility. We know the work that you do and its importance to us. Thank you for that. And thank you also for helping us to continue to uplift and enhance that work for all of our future. I want to just turn back to find out if there are any final comments from.
Yes.
Thank you.
Madam President, I'd be remiss if I didn't recognize the very competent medical staff that assist us. In today's correction world, we have a number of people that have mental illness, but they come to us also with medical issues. And Director Hadeen's staff, along with Dr. Ogawa. Thank you very, very much for assisting our staff, because we simply don't have the expertise to handle some of the challenges in front of us, but we know we have ready, skilled, and talented staff in the medical area and the mental health area that helps our staff and our inmates.
And I think, Madam Chair,
Sheriff, go ahead.
I think we have one other speaker that was going to come up and say a few words.
Thank you. Thank you. I want to thank the board for recognizing us here today and your continued support of the 135 full and part-time correctional officers at the Ramsey County Correctional Facility in their efforts to keep our community safe and be a positive influence on the inmates in their care. I'd like to take this opportunity to recognize a few of the accomplishments of the officers at RCCF. As everyone over the past year knows, the CEOs of RCCF have had to deal with the whole new normal. As essential workers, our CEOs come to work every day and continue to do their jobs despite the stress and the unknowns associated with COVID. Their correctional officers were instrumental in the preparation and implementation of our COVID protocols and the changes to our daily routines. Their dedication to the facility and to the safety of staff and inmates was second to none. Our kitchen officers have also taken on extra duties. They have taken on the task of not only providing meals for the inmates at the RCCF and the JDC, but they are also preparing meals for 6 shelters throughout Ramsey County. They have done the extra work and have continued the high standard that we have established. Again, I'd like to thank you on behalf of all the correctional officers and staff at the Ramsey County Correctional Facility. Thank you.
Thank you very, very much. We appreciate those additional comments about the work that is being done, not only on behalf of the correctional facilities, but also the other residential facilities for which work is being done. Once again, I just so appreciate seeing you before us and being able to send back thanks to everyone. It is a big team. I am also glad that Under Sheriff Finney has recognized the support that the team receives from elsewhere in the organization. And yes, it is a big team. We are all in this together. And we thank you for coming before us to share your work with us. Blessings to all of you as you continue in your work. Have a great day. I want to make sure that you all get your chance for the photo in the chamber. But given that proclamation and the hands that are physically clapping, and I would imagine we'll see some reactions on the screen too. Thank you once again.
Thank you.
Moving on to our administrative agenda then. I'll go back to Commissioner Fretham to take us through the administrative items.
Chair Carter, do we want to do the COVID update first?
Oh, thank you. Just found it. Okay. I appreciate that. Let me modify my order then and request the COVID update from our county manager. Thank you, County Manager O'Connor.
Thank you, Madam Chair and members. I will turn it over directly to Deputy County Manager Kathy Hadeen and some additional guests we brought in our continued work to show different parts of our public health response.
Thank you, County Manager O'Connor, and thank you, Madam Chair and Commissioners, and good morning. I'll provide the situation update with the case and vaccine data dashboard. Dr. Ogawa, our medical director, is here along with Incident Commander Laura Anderson to provide vaccine hesitancy information, variant updates, as well as info on partnerships in our community. And then we'll welcome Michael Reed and Jen Schreifels to highlight the work of what it takes to produce COVID testing and vaccine sites, ensure the safety of everyone involved, and truly hold together a public health department during a pandemic. So if we could move over to the dashboard, we'll go through the situation update. So in Minnesota, in total, 580,340 people have been confirmed positive for COVID-19. And unfortunately, we've lost 7,163 people to COVID from across the state over the past year. In Ramsey County, 50,141 people have been confirmed positive, with 831 people who have passed away due to COVID-19. The good news always comes after that, and that's 279,178 people in Ramsey County have received at least one dose of vaccine, and 198,841 people have completed their vaccine series. As we scroll down, we'll see that weekly case rates continue to hold around 20.5 cases per 10,000 residents. The positivity rate is also holding at about 5.4%, and positivity rates range in the metro area from 5.4% up to around 9% over in Anoka County. We're still watching these positivity rates inch up across the metro area, which is a reminder to continue to wear a mask around others, social distance, get tested every 2 weeks, especially if you have school-aged kids, and pay attention to your symptoms too. It's a little difficult this time of year when we have allergy symptoms that are similar to COVID symptoms, but it's always good to go get tested every couple of weeks. Mike, if you would please move over to the vaccine dashboard. We can see that over 46,000 doses have been administered or distributed by our public health department since we started providing vaccines. We've been providing around 2,500 shots each week for the past couple of weeks. We are seeing a drop in the number of people ages 18 and up who are accessing our large clinics. We are adapting these clinics to continue to create access for communities where it's difficult to access larger sites or health system clinics. Instant Commander Laura Anderson will talk more about that in a moment. As a reminder, you can go to ramseycounty.us/coronavirus and find information on vaccines and testing. I will now turn it over to Dr. Ogawa for additional information. And we can move away from the dashboard, please.
Deputy County Dean, County Manager O'Connor, and Madam Chair and Commission, thanks for having us here today. I get to start off with a little bit of the difficult news, and that is that dip in vaccines that we see. We do think it's multifactorial. We think that it's related to really actually now seeing a little bit more of the hesitancy around vaccines. Those who wanted vaccine, we didn't have enough to get to them initially, and now we have more vaccine and slightly fewer less people potentially ready to get that vaccine. And so a lot of what we're doing now is making sure that we're getting to communities that may have a little bit more hesitancy, listening to those communities, and then responding appropriately to them. The other thing that we think has been happening is that the pause in Johnson & Johnson, which I spoke about last time, has had a bit of a, I don't want to say chilling because that's a little bit stronger, but a cold effect on individuals wanting to get vaccine as well. You know, Johnson & Johnson is a very good vaccine. The FDA and the CDC have looked at the now 7 cases of identified venous thrombosis associated with the Johnson & Johnson vaccine, feel very comfortable and very strong that actually the risk for those same individuals, had they gotten COVID, was 8 to 10 times more likely that they would have those thrombotic complications with the virus infection than with the vaccine. And so the risk associated with the vaccine is actually lower than it is if people were to get the infection. I think that's a really important message that we continue to try and get to the public, because people are, naturally worried, but the effect of getting COVID is much more significant than from the vaccine. We're hoping that as we also increase, well, the other thing that makes Johnson & Johnson helpful is that it is a single dose. And one of the metrics that we talk about is we are seeing some individuals not getting that second dose. And when a person doesn't get the second dose of Moderna or Pfizer, they're not considered completely covered. And so it's an inadequate protection. So we want to be seeing those completed vaccinations rising. we are also working to monitor and watch other metrics like the number of breakthrough infections. One of the concerns is that as we see more variants, that we may see that our vaccines are less effective. And so we're watching carefully for those breakthrough cases. We don't have, I had hoped to have the exact numbers for you today, but I don't have those. But we know we are seeing a handful of them, and so we're watching them carefully. And then and also those delaying that second vaccine is important because we want to make sure that we're reaching out to them and having them get in for that vaccine to be fully protected. I'm going to mention also the fact that our numbers in Minnesota are really very good, but they're nowhere near where we need to be to get rid of those other mitigation efforts. I think we can't stress enough that the necessity of masks, the necessity of distancing from individuals, and just as Deputy County Manager Hadeen mentioned, testing. We really only know when many individuals are positive if they test and if they have, because the symptoms can be mild in younger children, can be mild potentially in individuals who've been vaccinated, and so the importance of testing continues top on our list as well. I'm going to turn it over to Incident Commander Lori Anderson.
Before you do, I'd just like to reach back for a question. Commissioner Ortega has had his hand up. Commissioner Ortega?
Thank you, Madam Chair. Dr. Ogawa, I just want to ask a question. For those folks that get the COVID, the virus now, could you clarify about, some of the language that's going around is that it mutates within the person to the next strain. So folks have asked me, is that true? And I said, I don't know. I'll ask Dr. Ogawa at the next meeting. So if you could give us a little science lesson here.
I'll do my best. Every time a virus replicates, it can actually mutate. So as the virus replicates in an individual, it can mutate somewhat. While it's in the person, though, does it then create enough of itself to be considered a variant? Not usually. It's usually with the transmission to another person and the amplification of that replication where we see those variants arise. However, going back to sort of the beginning of your question, people who have gotten COVID already, if they get reinfected, it's going to become very important for us to be able to tell if they're reinfected because it's a new variant, if they're reinfected because their own body's immune system doesn't recognize the virus again, or if they're vaccinated, if that variant or that virus got around that vaccine. So as we begin to see people getting reinfected or new infections, we have to break down all of those reasons why they may become positive again and be reinfected. Is that helpful?
Thank you very much. That was a very good, even I understood that. So thank you very much.
Thank you. There is another hand up from Commissioner McGuire.
Thank you, Madam Chair, and thanks again, Dr. Ogawa. You are amazing how you can explain these things so that we can all understand them. Could you just repeat one more time, because you said it's still important to get tested, even if, so like if you've been vaccinated and you're doing everything and then all of a sudden you feel sick or something, you should still get tested because you want to know if it's out there, right? I mean, people say, well, that's okay, I'll just let it run its course. Unless I get really bad, why would I need to get tested? Why don't I just let this be like the flu and let it run its course? But you say go get tested so that we have a sense of what's out there. Could you just say that one more time? Because I think it was really important that I think people might not think that that's important anymore.
Absolutely. So one of the things I think to remember too is the folks that we highlighted last week in our contact investigation and contact tracing group, we only know where to go and where to focus when we have those positive tests. And so we only know, and we only need, if people are tested. And especially, I mentioned young children and individuals who can't be immunized are certainly at high risk to have disease. And then the other concern that we have is that individuals who have been vaccinated can have lower levels of virus, but still be potentially infectious. It's rare, but it's still a possibility. And again, the only way we often know is if people have been tested. I know probably we're not supposed to share personal stories, but as a provider of care, in my current clinical situation within public health, I was knowingly exposed to an individual who ultimately tested positive. So I took extra precautions in PPE, and I also got tested at day 5, because that's when it would have shown up, and then I also got tested again at day 14, just so that I made sure that I was not potentially infected and could pass it on to other patients or other coworkers. And for students especially, the recommendation by MDH is a good one. Being tested every 2 weeks, regardless of how people are feeling, allows us to also make sure that within school settings, people are not being exposed and then carrying that infection out to their family members who may or may not have been able to get vaccinated yet. And especially sports. Sorry, one more thing, especially sports, because we know that even though we're using masks within our sports, the risk is still high.
Thank you. Thank you, Dr. Ogawa. And while we're on the topic, I know we can go online and get this, but just some of the symptoms are, high temperature, nausea, if you're feeling sick at all, right? Go get tested.
Yes. And even milder symptoms, headaches that aren't usually explained, that you don't usually have, sore throat, and any kind of shortness of breath or cough. Again, Deputy County Manager Hadeen mentioned it's going to be a very difficult right now because it's also Minnesota allergy time. And so, but I'm telling all of my patients, telling all of employees that it's much better to be safe than sorry. If you feel a little bit sick, getting tested is much better than potentially exposing or transmitting to others. The current variants are, anywhere from 20 to 50% more infectious, and so we worry that they're more infectious to others.
Thank you, Dr. Gawa.
Thank you so much. Thank you so much.
We have no further questions and can move on at this point.
Madam
I'm
Chair,
sorry.
There's one more.
Yeah.
I didn't know. I apologize. I do see a couple more hands up now. And so I'm going to call on Commissioner Fretham and then Commissioner Reinhardt.
Thank you, Chair Carter. Dr. Ogawa, I'm just wondering, there's more and more reports that there may be a decision soon on expanding access to vaccine for youth ages 12 to 15. I'm wondering if you could just outline a little bit of, if that approval is done, what further steps need to happen before youth would have access for it, and what planning might already be in place to get those distributed.
Yeah, actually, we're very excited about this. Glad you mentioned it. We're hoping that there will be an announcement and a decision about Pfizer being able to be used for 12 to 15-year-olds soon. Because again, like we mentioned, we need everybody vaccinated, youth, adults, and elders. The Pfizer is the vaccine that is the most temperamental, for lack of a better phrase. And so it requires a deeper freeze. Once it's out of the freeze, it's good for only about 6 days. And so throughout the time that we've been vaccinating, we have been utilizing Moderna within Ramsey County, but many of our partners are utilizing Pfizer. The other hope is that health systems that have potentially more access to deep freeze and also to patients in a more standard way, primary clinics, pediatrics clinics, where people are used to getting their vaccines, will also have more access to Pfizer and potentially, ultimately, the other vaccines. We've been working really hard within Ramsey County, working with schools and school nurses. We have a wonderful relationship with them. If opportunities occur that we can be providing or helping to support in those settings, where also students and families are used to sometimes getting vaccines, we'll be there to do that as well. So we're looking forward to it, planning and getting ready for what other changes may need to happen.
Thank you. Commissioner Reinhardt?
Thank you. I also want to acknowledge that people, because of distance learning and people thinking, okay, well, once you've got kids back in school and you've got different things going on where, because the restrictions obviously have been loosened, which is appropriate, and the governor is going by the science and moving forward and trying to get things open as much as possible. But especially with kids in school, I know from my own experience with my grandchildren, they are doing distance learning, but my grandson was back in school for one day. They're kind of, phasing things in for all of the kids. And he was exposed. And so just because there have been these steps that have been taken, people shouldn't jump to the conclusion that they don't have to pay attention, because every time, even with kids, because we know that they carry it and can obviously get it as well, that we have to be careful, because it's not just, okay, we can be, once they're back in school, then we can pretend in many ways that it's still not a major issue. Because even if it goes down to 12 years old, the younger kids are still going to be carrying it and bringing it within the community. So I just think it's important, again, to stress how we can't, the restrictions that are in place are much less than they were. But we need to keep those in mind. And when I go by places where there are often lines and I see a lot of people without masks and closer than 6 feet, and in your own group, that's different, but clearly not, or feeling like it's over and it's not. I guess that's the simple message. I could have said it much easier. It's not over. Mm-hmm. And our kids are the ones that are going to be hurting with this as well. So the emphasis on the younger students and kids, I think, is incredibly important. But really, let's not do a hip, hip, hooray. Not yet, anyway. Thank you.
Thank you, Commissioner. Turning back to you, Dr. Ogawa.
Yeah, actually, I appreciate Commissioner Reinhardt's comments. I do unfortunately get to end often with the statement that we're not done with this pandemic yet. We see the light, but we're not done. As we move forward in talking about and highlighting our pandemic response too, we'll highlight that a lot of what we're looking at now in terms of what our safety officer, Jen Trifles, needs to deal with is also planning on, workers coming back, but within reason, and being careful and not opening things too fast, and keeping in mind the safety of our employees and our public as well. So I'll turn it over to my Ensign Commander Laura Anderson.
Thank you, Dr. Ogawa. Madam Chair, Commissioners, just a few items to add before I introduce our logistics chief and our safety officer. As Dr. Ogawa has mentioned, as we reopen facilities, I think we're doing some really great work around co-locating vaccine opportunities at those same sites. So we've been in close communication with private providers, Blue Cross Blue Shield, mHealth Fairview. We're working very closely with those providers to make sure that vaccine is available where folks go. So we're talking about libraries, we're talking about WIC clinics, we're talking about heading back into schools and offering Pfizer so that kids can go ahead and graduate with their classes. Those have been really important pushes for us in terms of allowing folks chances to celebrate and feel safe with their community. Last week, I did note that our FEMA vaccine clinic at the State Fairgrounds was open to select zip codes only. Over the past 7 days, they have enhanced or reduced eligibility requirements, I guess I should say, and are allowing walk-ins from residents across Minnesota. And walk-ins will be allowed all the way through today. So if you know anyone who's seeking a shot and they're 16 or older, they're eligible to head over and get their first shot of Pfizer today. After today, they will actually go ahead and only be providing second doses of Pfizer to the same audience who received the first dose. We've really seen offerings for public clinics skyrocket over the past week and a half. Sometimes as many as 10 different vaccine opportunities in 1 week, where before we had 1 or 2. So it's been excellent to have that level of partnership and competition as we move through our vaccine distribution. I want to go ahead and introduce someone who's been really invaluable to allowing us to make those nimble shifts in how we distribute vaccine. Michael Reed has been with the county for more than 25 years, and I've known him in his previous work as a manager for managing solid waste and hazardous waste with the Environmental Health Division. But he very ably took on the role of logistics chief last spring and has been helping support us with not just staff and stuff, which I think is sort of the traditional role of logistics, but actually working closely with planning and operations to make sure that we do right by our community and offering vaccine as nimbly as we can. So, Michael.
Thank you, Laura. Madam Chair, Commissioners. Logistics continues to support the county's COVID response through the following efforts. We've been partnering with Public Works for warehouse space in order to provide all the county departments with PPE and other pandemic-related supplies. We've been partnering with the State Fairgrounds to offer a centralized vaccine testing clinic in the fall and early winter. We've called on a 15-year partnership with North Heights Lutheran Church as well as White Bear School District to provide vaccination clinics. In addition, the City of New Brighton and St. Paul Parks and Rec have also been very gracious hosts for our vaccine clinics. We've been maintaining supplies for essential services to distribute to residents in need. We've been coordinating the use of fleet vehicles for use by public health in the areas of essential services and logistics. We've been operating 2 warehouses to store the county's PPE supplies and related equipment and tracking all the inventory at both locations. We're ensuring all the necessary supplies and equipment are delivered, maintained, set up, and taken down at testing and vaccine clinics. We're confirming staffing for all the clinics, evaluating and visiting potential new clinic sites and providing recommendations on feasibility, ensuring vaccination clinics are resupplied after each event, transporting and tracking a vaccine temperature during the vaccine clinics, coordinating with emergency management around site security and shared warehouse space, and ordering and distributing reusable cloth masks to 4,200 county employees on 3 occasions. And it took us 3 times to get it right. We don't see too many people wearing the white and the gray, but the fashionable black with Ramsey County branding on it seems to be a hit. So we're thankful to be able to deliver that well into the pandemic. Thank you for the opportunity to present today.
Absolutely. And one more guest is on Zoom with all of you, Jen Schreifels. If you want to turn your camera on and highlight the work around safety. Perfect.
Hi, good morning, Madam Chair and Commissioners. So as Deputy County Manager Hadeen mentioned, I am the safety officer for the COVID-19 response for the Public Health Department. So myself and my team, we work to ensure the health and safety of the staff that are involved in the COVID-19 response. So we do work mainly with the public health department, but we have been involved in various work throughout the county with lots of different teams in safety, policy creation, and planning. So some of the duties that the safety team works on, we produce a regular safety analysis of the response operational activities. So for example, the essential services deliveries, testing and vaccine clinics, community outreach. We work with those teams to develop mitigation strategies and ensure staff safety in those activities. So as you can imagine, the responsibilities of the safety team have evolved quite a bit over the course of the pandemic. Initially, there was a lot that was unknown about how COVID-19 was transmitted. So there were a lot of requests to meet with various groups to go over basic safety and hygiene recommendations. But now a lot of that has evolved since I feel like most of us have a pretty good grasp of how it's transmitted and how we can keep ourselves safe. So now we're doing a lot of work around redesign of county services and looking at ways that we can ensure staff safety as we reopen services. Safety has worked a lot with logistics. So Michael's team, especially early in the response when there were some shortages of certain types of PPE, in particular respirators for healthcare staff. So we worked closely with them in finding appropriate gear for our staff to wear. Safety was also pretty heavily involved in the creation and implementation of the countywide face covering policy. And I also want to mention that I'm not alone on this team. There are two other officers that work in safety. One has primarily been focused on site-specific safety plans. So he does a lot of work around Workplace 2.0 plans. So the plans that were developed to kind of change how we work and ensure that staff are doing their work safely, have the equipment they need to do their work safely. He has done a lot of work in public-facing spaces such as libraries. So looking at layout and capacity and how those public-facing places can operate in a safe manner. And then another important role on the safety team is for staff health and wellness. So pretty early on in the pandemic, staff were coming to their supervisors and reporting they were feeling exhausted, burned out, feeling like they needed some support. So we implemented this position, this Deputy Safety Officer facilitates regular wellness sessions. She brings in guest speakers with various expertise. She shares mental health and wellness resources with staff, and then also facilitates sessions sort of as requested on specific topics that staff may request. Yeah, so that's the safety team in a nutshell.
Madam Chair, and to every presenter today, thank you for your presentations and getting to see different areas of our work. That's our COVID-19 update today. I'll just add that, but for the safety team, we would not be able to plan a return to the chambers for the county board. So they have been sitting alongside myself and others during that planning process as well. And so I can just tell you from experiencing it firsthand, they think of every potential question and eventuality and things that honestly, I don't think we all would think of day to day. And it makes me feel good about our employees across this organization for how we're thinking about their safety and how professionals are making sure we consider all of that.
Thank you very much. I have a question or comment from Commissioner Reinhardt.
Thank you. Sorry, I know that we've got a lot on our agenda today, but one thing that has been really disturbing to me is the fact that throughout this and even continuing now is the folks that try to politicize this issue. It's not about politics. It's about valuing your own life and your loved ones and knowing that others are loved and valued as well. So I just wanted to reinforce the love thy neighbor as thyself. And that's what this is about. It's about keeping people safe. It's not about politics. And it's time everyone recognizes that. Thank you.
Thank you very much, Commissioner Reinhardt. And to all who have presented to us today, thank you for sharing these lines of work that have been created as a result of our responding to COVID-19. The various sets of work are complex and necessary, and we so much appreciate all that you are doing to make certain that we are able to figure out all of the details for responding, for ensuring our safety, for continuing to deliver services throughout our COVID-19 response. And so it appears as though we have asked the questions that we need to, checking back in before we move then on to our administrative agenda with County Manager O'Connor in any final comments. I think you did them.
Madam Chair, no, thanks to every speaker today showing off different parts of the work. And you're seeing how people, whether they're newer in the organization or have been here for quite a while, are finding ways to adjust and adapt and be a part of coming together to serve this community and this organization in a time of need. So gratitude toward all of them.
Thank you. And so now I get to turn to Commissioner Fretham to take us through our administrative agenda. Commissioner?
Thank you, Chair Carter. I'd like to move item 4, property tax abatement, and item 5, 2021 Special Board of Appeal and Equalization.
Second.
Thank you for the motion and for the second from Commissioner Mattis Castillo. Is there any question or comment on the administrative items? I'll call on the clerk to call the roll, please.
Fretham.
Aye.
Meta Castillo.
Aye.
McDonough.
Aye.
McGuire.
Aye.
Ortega.
Aye.
Reinhardt.
Aye.
Carter.
Aye. Thank you. The administrative agenda has passed. Commissioner McGuire for our legislative update now.
Thank you, Madam Chair. Well, we are closing in on the last 2 weeks of session, which is amazing that it's gone this fast. So Jenna Rourke and Melissa Finnegan are madly trying to keep up with all the conference committees that are meeting. The session is scheduled for adjournment May 17th, but there's much talk about it going beyond that for special session, which seems to be a normal occurrence. But anyway, the scheduled adjournment is in a couple of weeks. So the conference committees are meeting. They're following a more of a schedule, which is unusual, that they meet either from 9 to noon or 1 to 4:30 blocks. And so the committees are on top of each other. So there's lots of committees to follow, but they're doing a great job, and they're keeping staff. And I know all of us aware if there's an event or an issue that we need to be aware of or to speak on, we're aware that those committees are meeting. On the bonding front, the Senate has started some hearings. There was question whether Senator Bach was going to be holding hearings. They're going to be doing that, so we'll see what they decide to hear. The Among American Partnership bill is up today, and Commissioner McDonough will be testifying. Thank you so much, Commissioner McDonough, for that. And we had a board resolution earlier in a few weeks ago that authorized support for a technical change on that issue. So thank you for that. Now, and we're all continuing to wait for the American Rescue Plan guidance. This is local governments and the state and us. So we're all waiting for the federal government on what we are going to be able to allocate that money to. And then on the federal front, we have news that Congresswoman McCollum has submitted, 3 of our projects forward, which we're very excited about, and they include the Rice Street revitalization, Bruce Vento Trail, and violence prevention grants. So that's exciting that those have been moved forward in the federal process. So with that, Madam Chair, just thanks everyone. Thanks to our legislative team of Jenna Rourke and Melissa Finnegan and Commissioner and Mattis Castillo and myself, and for all the work that's being done, and Elizabeth Emerson and Pierre, who are our lobbyists, have been attending our meetings too. So if anyone has any questions, great. Otherwise, if others have other issues that they'd like to bring up at this time, that would be great. Thanks.
Thank you very much, Commissioner McGuire. A hand is up from Commissioner Reinhardt. Commissioner?
Yes, and I was in a meeting last evening with that some legislators were on, and one of the reasons that they are concerned about the session being complete is not necessarily about the normal work that they do, but about the waiting for the federal guidelines and how slow they are. And so I wanted to kind of double back on that one as far as a question. That's what I'm hearing. It's not about them not working hard because they are, but they can't really finish until that's done. And if they don't get that, and it sounds like they won't get it until just before when they are supposed to stop. And so if it does go on, it's likely because of not having the guidance that is absolutely necessary, because they can't make decisions without that. So I wanted to point that out.
I appreciate that, Commissioner Reinhardt. That's a really good point. And I did brush over that. I think we're all getting a little used to the special sessions for good reason. I mean, some of them are for good reason, that, you know, they need to wait now. So thank you for bringing that up. That was good.
Well, we appreciate the update from you, Commissioner McGuire, and thank you for the additional comments also from Commissioner Reinhardt. The County Connections is the next item on our agenda, and I'll turn to County Manager O'Connor.
Thank you, Madam Chair. Commissioners, just a few updates. One that's a few weeks overdue. You had received this over email from County Assessor Luis Rosario. The 2021 Assessors Report is available online. If you wanted to find it and did not have the email from before, you just go to the big white box on ramseycounty.us, type in Assessors Report. It's the first piece that comes up. It is wonderfully done using the open data portal and really shows the power of continuing to improve how we can share information using that tool. We will talk more about the specifics in the assessor's report as we move into the budget season, as that's always a part of the budget presentation day at the outset. So more to come, but I'll steal Luis's thunder on one spot and say property values on the aggregate are up about $2 billion in Ramsey County. And that's a good news sign. Light industrial is what's really carrying the way in this community, but you can see the dynamics of different property values, and it's helpful to see as we continue to do our work. The Star Tribune ran a series of articles this past week and then an editorial today on fines and fees work. Ramsey County was mentioned in that work, thanks to Deputy County Manager Scott Williams for talking about the work led by the board through the organization to eliminate fines and fees and why that's an ongoing issue in our community, but across the nation as well. And it ties well to some of the our proclamation today, and there's the systematic work happening as well as bringing the right people in to serve on the front lines in our facilities. Just wanted to highlight the continued push around fines and fees and the importance of highlighting that work as we go forward. I had an opportunity to present to the Charter Commission, the Ramsey County Charter Commission last night. For about 90 minutes, we talked on 4 different topics that were of significant interest to them, as there's been some turnover on the Charter Commission, questions and topics they wanted to do. They received the Dr. Ogawa COVID-19 update that you got to hear today. So we did spend a significant portion of time talking about vaccination and rollout, and then dove into the topics of racial equity, transforming systems together, and census work and the results from the recent census count. It was a great opportunity to spend time with the Charter Commission. I appreciated the invitation and an opportunity for them to see how the charter, which outlines the form of government under which we operate, how it kind of works on some topics of interest to them. And I hope they enjoyed the opportunity as well. And then finally, as I mentioned briefly during the Safety Committee update, we're continuing conversations about looking forward while living in the reality of public health and where we sit. Today's From the County Manager column is focused on the organization's overall phased return to the workplace and moving the date from Memorial Day, which was what it was previously set at a few months back, to Labor Day. Recognizing that with vaccination ongoing, with a lot of change around flexible workplace policy and a survey going out to all staff in the next couple of weeks, we want to be thoughtful and methodical and not bring people through change multiple times over a few months. And we will continue to make service delivery changes as we go on a case-by-case basis to meet need where we see them. But the broader wide-scale piece will be moving to early September, and we do think that date will likely stick. That date is consistent with the county across the river as well. So Hennepin has a September 7th date for starting their phased-in work, and so it aligns very well with a lot of the large employers across our region, both public and private sector. That's all I have, Madam Chair. Thank you for the opportunity to share some updates.
Thank you very much, County Manager. I have no questions up for you. We appreciate all that you've shared regarding our county, and we will move in then to our board updates. I'll begin the board updates with Commissioner Mattis Castillo. We'll round back alphabetically to Commissioner Fretham. Commissioner
Thanks,
Mattis
Madam
Castillo.
Chair. I don't have any updates today. Thanks, Madam Chair.
Thank you very much. Commissioner McDonough.
Thanks, Madam Chair. A couple real quick. We had a mosquito control board meeting. A number of us were on as we head into the summer season here. And I just remind everybody, we talk about COVID a lot, which has overtaken our public health system, but mosquitoes are a huge part of the spread of disease in our community, and the work that mosquito control does in helping control that spread is really important work. And the side benefit is it can help with the nuisance of mosquitoes also. So we're heading into the summer season. Also, real quick, Raphael, and you could maybe talk a little deeper. We had an executive control board meeting for the Gold Line partnership, or the Gold Line, which is comprised of Washington, Ramsey, and Met Council. Whenever there's changes in scope or budget to the project, we had to approve a couple things there, and we had a Gold Line Joint Powers Board meeting with Washington County to really start moving now that we've gotten the approval from the FTA to move into engineering, and hopefully not too long we'll be starting construction on that line. Thanks, Madam Chair.
Thank you very much, Commissioner McDonough. Commissioner McGuire.
Thank you, Madam Chair. Just a few things. Appreciate Commissioner McDonough bringing up the Mosquito Control Board. We did give our executive director a positive review. We feel that he's doing a good job, and so he'll be staying on for the next few years. So that's good. Just a couple of highlights of the week. The young adult convening that we all attended with the Workforce Solutions Director, Ling Becker, where we all were able to have a conversation with our young adults, was just a real, it was a great event for all of us, I think. And so just thanks to Director Becker on that. And then Commissioner Mattis Castillo and I were treated to a capstone presentation of University of Minnesota team, a graduate level team on health equity implications of Ramsey County roads. And I just am going to encourage all of us to see this presentation. I'm working with Ryan Isaacson and Scott Merrick, who were their liaisons on that, to see how we can get that work presented to this board. I definitely want to present it to active living Ramsey communities, but it really was a powerful presentation on how they, the studying they did in Ramsey County and how we really combine, health equity and our public works department. And just a shout out to Brian Isaacson, but Scott Merrick, who's a newer employee in our public works, but he's the son of Dwayne Merrick. So many of us know Dwayne Merrick from Stearns County Commissioner, who retired, but Scott is his son, and we're so lucky to have him here in Ramsey County doing public works. And so it just was fun to be working with them, and it was just a great presentation. So hopefully more to come on that when we are able to present more of that work to the board. Thanks, Madam Chair.
Thank you very much, Commissioner McGuire, and for highlighting what sounds like a very insightful presentation we'll look forward to. Commissioner Ortega.
Thank you, Madam Chair. Let me just, since most of what I attended last week has already been, by my colleagues, has already been reported on. Let me just give a shout out to the West 7th Street Federation. Last week was their district council annual meeting, and all the good work they've, West 7th has done a tremendous job in terms of dealing with COVID and getting some of our elderly vaccinated and so forth, our clinics in that neighborhood, and just the community in general. Sean Kershaw, the new Director of Public Works, was the main speaker, and he did a fantastic job. And so just a welcome to him, as we will be partnering with the city on many projects down the road. Thank you, Madam Chair.
Thank you very much, Commissioner Ortega. Commissioner Reinhardt?
Thank you. Well, I do want to also talk about the convening young adults event that we were all at. Pretty amazing. It was the second one that I've participated in, and the young adults through Workforce Solutions and setting that up. It's just really inspiring to see young folks and to talk with them about issues that are incredibly important to all of us. So I'm looking forward to doing that in person at some point here. Anyhow, the main thing that I just want to talk about again is the American Climate Leadership Summit that I attended, and how the work that is going on there is not just obviously for local governments, but it's the entire world, and the climate change activities that are taking place, and the hope and the innovativeness that we as human beings can bring to a subject that is really important, and talking about the urgency of it as far as the data. And we don't have time to sit around and admire this problem anymore. I mean, I think that's obvious to folks, and you know, it's about our kids' future. It's about our grandchildren's future and beyond, but it's something that needs to have action now. And I think that I had mentioned that I'm part of the National Climate Change Task Force. I've got to make sure I get the name right. Climate Action Task Force, I'm sorry, through the National Association of Counties. And the National Association of Conservation Districts did submit a letter to the Department of Ag, U.S. Department of Ag. And one of the things, and I'd like to read just one line out of it, and that is, let's see here, NADC, that's the National Association of Conservation Districts, understands that there is an immediate need for significant action to address climate change. The cost of inaction ranges from serious impacts to human, animal, forestry, soil, and plant health to a drastic effect on the world economy to complete environmental degradation, making life unsustainable. Action is needed now. Thank you.
Thank you very much, Commissioner Reinhardt. Commissioner Fretham?
Thank you, Chair Carter. As already meant, a lot of the activities were already mentioned. Commissioner McGuire and I also got to stop by the steering committee meeting for the Suburban Ramsey Emergency Collaborative and talk about our workshop on the American Recovery Plan, our intentions as a county and how we want to move forward with those funds, and a continued space for this group's work to help the community and what funding needs there are.
Thank you very much for sharing that information. I am going to, as a number of activities have been mentioned already, forego the opportunity to provide an update so that we can move into our next meeting, which is to be chaired by Commissioner Maris Castillo. It is our Housing and Redevelopment Authority meeting. After this meeting immediately, we will go into the Housing and Redevelopment Authority meeting on this link, and that will be followed then by a county board closed meeting to discuss a legal matter. Thank you all for your updates and for the content of our board meeting today. And we then will be adjourning this meeting and going directly into the Housing and Redevelopment Authority meeting. We are now adjourned.